Dog bites are a serious public health concern in the United States, and yet, many people do not fully understand the scale of the issue. In this opening chapter, we will explore what dog bites are, why they happen, how common they are, and why every American should be aware of them. Our goal is not to create fear, but to spread knowledge, encourage responsibility, and promote safety for both humans and dogs. Every year, millions of Americans experience some type of dog bite incident. According to estimates from the Centers for Disease Control and Prevention, CDC, approximately 4.5 million people in the United States are bitten by dogs annually. Out of these, about 800,000 people require medical attention. These numbers are not just statistics, they represent real families, real children, and real adults who suddenly find themselves dealing with injuries that could have been prevented. When we think about dog bites, we should remember that dogs are not naturally aggressive creatures. Dogs are loyal companions, protectors, and family members. The United States is home to over 90 million pet dogs, and most of them will never bite anyone in their lifetime. However, just like humans, dogs can become scared, anxious, territorial, or even defensive in certain situations. It is usually these emotional states, fear, stress, or protection of territory, that lead to bites. Understanding this dynamic is the first step toward prevention. One of the most surprising facts about dog bites is that most incidents do not occur with strange dogs on the street. In fact, the majority of bites happen at home or in familiar environments, involving dogs that the victim already knows. This is why parents, families, and dog owners must take extra responsibility when children are around dogs. Young children are among the most common victims because they may not know how to interact safely with animals. They may hug too tightly, pull a dog's tail, or get too close to a dog's food or toys. From the dog's perspective, this may feel threatening, even though the child had no intention of harm. Dog bites can range from mild to severe. Some are just small scratches that heal quickly, while others can lead to serious infections, torn skin, or long-lasting scars. In extreme cases, they can even result in life-threatening injuries. For this reason, hospitals and urgent care centers in the United States deal with thousands of dog bite cases each year. Beyond the physical injuries, there are also emotional and psychological effects. Children who experience dog bites may develop a long-term fear of dogs, while adults may face stress, anxiety, or even legal issues if their own dog was responsible. It is also important to recognize the legal and financial side of dog bites in the United States. Dog owners are usually held legally responsible for injuries caused by their pets. This can lead to lawsuits, medical bills, and even insurance claims. According to the Insurance Information Institute, dog bites account for over 1/3 of all homeowner insurance liability claims in America, costing hundreds of millions of dollars every year. This shows that the problem is not just personal, it affects communities, healthcare systems, and even the economy. But here's the positive side. Most dog bites are preventable. Education, awareness, and responsible ownership can dramatically reduce the number of incidents. If dog owners learn to properly train, socialize, and care for their pets, and if families and children are educated on how to safely interact with dogs, then millions of bite cases could be avoided. In this series, we will take a deep dive into different aspects of dog bites. We will cover topics such as the psychology of dogs, the most common reasons behind biting, the breeds most often reported, the medical consequences, prevention strategies, first aid tips, and even the role of laws and insurance in dog bite cases in the United States. As we begin this journey, I encourage you to keep an open mind. Remember, dogs are not the enemy. They are loving companions who need our guidance, respect, and proper training. By understanding the causes and consequences of dog bites, we can create safer communities where both humans and dogs can live happily together. So, let's begin this important conversation. Dog bites may seem like a small issue to some, but when you look at the statistics, the real-life stories, and the preventable injuries, it becomes clear. This is a public health issue that deserves attention. In the chapters ahead, we will explore the facts, the myths, and the solutions to ensure that fewer Americans become victims of dog bites in the future. Dog bites do not happen randomly. Every bite has a cause, a reason, and a trigger behind it. Understanding why dogs bite is one of the most important steps in preventing them. In this chapter, we will explore the many reasons why dogs may bite, looking at their instincts, their emotions, their environment, and even their health. By learning about these causes, families and communities in the United States can take proactive steps to keep both dogs and humans safe. Let's begin by addressing an important point. Dogs are not naturally violent creatures. For thousands of years, dogs have lived alongside humans as companions, workers, and protectors. Most dogs will go their entire lives without ever biting anyone. However, when a bite does occur, it is usually the dog's way of communicating something it cannot express in words. 1. Fear and anxiety. Fear is one of the most common reasons behind dog bites. Just like humans, dogs can experience stress and anxiety. When a dog feels trapped or threatened, biting becomes a defense mechanism. Imagine a situation where a child suddenly runs toward a dog, waving their arms and shouting. Even if the child's intention is innocent, the dog may feel scared. With no other way to protect itself, it may bite. This is why experts often say, a fearful dog is a dangerous dog. It's not that the dog is bad, it's simply reacting to fear. In the United States, many dog bite incidents occur because people misread a dog's body language. A dog showing its teeth, lowering its ears, or tucking its tail is trying to say, I am uncomfortable. Ignoring these signals can lead to bites. 2. Protection of territory. Dogs are naturally protective animals. Many breeds, such as German Shepherds or Rottweilers, were historically trained to guard property and livestock. In modern American homes, this protective instinct is still very strong. A dog may bite if it feels someone is invading its territory, whether that's a stranger walking into the yard, a delivery person at the door, or even another pet coming too close to its space. Territorial behavior is not limited to homes. Dogs may also protect their food, toys, or even their favorite resting spot. This is known as resource guarding. A dog that feels its resources are under threat may growl or snap, and if the warning is ignored, it might bite. 3. Pain and health problems. Sometimes, a dog that bites is actually suffering from pain or illness. Imagine a dog with arthritis, a tooth infection, or an undiagnosed injury. When touched in a sensitive area, the dog might lash out, not because it wants to hurt someone, but because it is hurting itself. Veterinarians in the United States often remind owners that sudden aggressive behavior in a normally calm dog may be linked to medical issues. This is why regular checkups are essential. A dog in pain should never be punished for biting. Instead, it should be evaluated by a professional. 4. Maternal instincts. Like humans, mother dogs are protective of their young. A female dog with puppies may bite if she thinks her litter is in danger. Even normally gentle dogs can become aggressive during this stage. This behavior is natural. It is part of the maternal instinct to keep her puppies safe. Families with children need to be especially cautious around mother dogs and newborn puppies. 5. Lack of socialization. Dogs need early exposure to people, other animals, and different environments. Puppies that are not properly socialized may grow up fearful or insecure. In the United States, animal behavior experts emphasize the importance of socialization within the first 12 to 16 weeks of a puppy's life. Without this exposure, dogs may react aggressively to new situations later in life. For example, a dog that never met children as a puppy may feel anxious when surrounded by kids. A dog that never saw bicycles or skateboards may see them as a threat. This lack of confidence can easily turn into defensive biting. 6. Overexcitement and rough play. Not all dog bites come from fear or aggression. Sometimes, dogs bite because they are overly excited during play. Puppies often nip when playing with each other, and if humans do not teach them boundaries, this behavior may continue into adulthood. While playful nipping may not seem dangerous, in larger dogs it can cause real injuries. For example, a Labrador retriever playing roughly with a child might accidentally bite too hard. This is why training and teaching bite inhibition is so important in American households. 7. Provocation, even if unintentional. Many dog bite cases in the United States involve unintentional provocation. A child might pull on a dog's ear, step on its tail, or try to take away its food. Adults, too, may provoke dogs without realizing it, such as hugging too tightly, staring directly into a dog's eyes, or interrupting it while sleeping. From the dog's perspective, these actions may feel threatening, leading to a bite. It is important to note that children under the age of 10 are the most common victims of dog bites in the United States. Their lack of awareness, combined with their small size, makes them particularly vulnerable. This highlights the need for both supervision and education. 8. Breed and genetics. There is an ongoing debate in America about whether certain breeds are more likely to bite than others. While breed plays a role, experts agree that environment, training, and socialization are far more important. Any dog, regardless of breed, can bite under the wrong circumstances. That said, some breeds are stronger and more capable of inflicting severe injuries, which is why bites from large breeds often make the news. 9. Stressful environments. Finally, we must consider the dog's environment. Loud noises, crowded areas, chaotic households, or constant teasing can create high stress for dogs. A stressed dog is more likely to bite. In the United States, shelters often see dogs that developed aggressive behaviors simply because they lived in unstable or neglectful homes. Conclusion of Chapter 2. As we can see, dog bites rarely happen without reason. Fear, protection, pain, lack of training, or even playful excitement can all lead to bites. The responsibility lies with humans to understand these causes, to recognize warning signs, and to create safe environments. By educating ourselves, we not only reduce the number of dog bite cases in the United States, but we also strengthen the bond between people and dogs. Remember, when we understand the why, we are better equipped to prevent the how. In the next chapter, we will explore the statistics of dog bites in the United States. Who gets bitten the most, which states report the highest cases, and what the numbers really tell us about this ongoing public health issue. When it comes to dog bites, numbers tell a powerful story. Statistics may sound boring at first, but they are essential for understanding the real scale of the problem. In this chapter, we will examine dog bite statistics in the United States. How often they happen, who the victims are, which states report the most cases, and what the overall economic and medical costs look like. By looking at these numbers, we gain insight into how serious dog bites are as a public health issue. 1. How common are dog bites in the United States? According to the Centers for Disease Control and Prevention, CDC, around 4.5 million Americans are bitten by dogs every year. Out of these, nearly 800,000 people seek medical attention, and about half of those require emergency room care. This means that 1 out of every 73 Americans will be bitten by a dog in a given year. To put it in perspective, if you were to gather a group of 100 people in the United States, at least one of them is statistically likely to experience a dog bite this year. That's a surprisingly high number for something many people think of as a rare occurrence. 2. Who gets bitten the most? Dog bites do not affect everyone equally. Certain groups are more vulnerable than others. Children, by far, children are the most common victims. The CDC reports that more than half of dog bite victims are under the age of 12. Children between the ages of 5 and 9 face the highest risk. Why? Because children often do not understand a dog's body language. They may try to hug, kiss, or grab a dog without realizing that the dog feels uncomfortable. Men versus women. Studies show that men are more likely than women to be bitten. Some experts believe this is because men are more likely to engage in rough play or approach dogs in risky situations. Delivery workers and mail carriers. In the United States, postal workers and delivery drivers are frequent victims. In fact, the United States Postal Service, USPS, publishes an annual report on dog attacks. In 2023, for example, over 5,300 postal employees were attacked by dogs. Cities like Houston, Los Angeles, Chicago, Dallas, and Cleveland consistently rank among the worst for postal worker dog bites. 3. Where do dog bites happen? Most dog bites do not happen on the street with stray dogs. Instead, they occur in familiar environments. At home, about 77% of dog bite injuries happen in the victim's home or the home of a friend or relative. This means the dog involved is usually one the victim already knows. Public spaces, parks, sidewalks, and neighborhoods are also common settings, especially when dogs are off-leash or not properly supervised. Workplaces. For postal carriers, delivery drivers, and utility workers, bites are considered an occupational hazard. 4. Severity of dog bite injuries. Not all dog bites are equal. Some are small scratches that heal on their own, while others require stitches, surgery, or even hospitalization. About 1 in 5 dog bites, 20%, require medical attention. Children are more likely to suffer severe bites to the face, neck, and head. Adults are more likely to be bitten on the hands and arms, often when trying to separate dogs during fights. Every year, about 30 to 50 Americans die from dog attacks. While rare, these fatal cases usually involve large, powerful breeds and multiple dogs attacking together. 5. Which states report the most dog bites? Dog bite data varies across states, but some patterns stand out. States with larger populations naturally report more incidents, but certain urban areas are consistently high on the list. According to USPS and insurance reports, the top states for dog bite claims include California, consistently ranks number 1 due to its large population and high number of dogs. Texas, a close second, with frequent reports of bites and attacks. Florida, New York, and Illinois also rank among the highest. Within cities, Los Angeles, Houston, and Chicago often top the charts for postal worker dog attacks. 6. The financial cost of dog bites. Dog bites are not just a medical issue, they are also a financial burden. In the United States, dog bites account for over 1/3 of all homeowners' insurance liability claims. According to the Insurance Information Institute, in 2022, dog-related injury claims cost insurance companies more than $1.1 billion. The average cost per claim was around $64,000. These costs cover medical treatment, lost wages, pain and suffering, and legal settlements. This shows that dog bites are not just a personal problem, they have nationwide economic consequences. 7. hospitalizations, and medical costs. Dog bite injuries often require serious medical care. In fact, dog bites are among the top 15 causes of non-fatal injuries in children in the United States. Every year, about 337,000 Americans go to emergency rooms because of dog bites. More than 10,000 people per year require hospitalization. Hospital stays can be very expensive, averaging more than $18,000 per stay, which is higher than the average for other common injuries. These numbers highlight the importance of prevention, because once a bite happens, the costs can be overwhelming. 8. Rabies and infection risks. Although rabies cases in the United States are rare thanks to vaccination programs, dog bites still carry a risk of infection. About 10 to 15% of dog bite wounds become infected. Common infections include staph, strep, and Pasteurella bacteria. Victims often require antibiotics, tetanus shots, and in some cases, rabies post-exposure vaccines, especially if the dog's vaccination history is unknown. 9. Long-term consequences beyond numbers. While statistics are helpful, they do not capture the emotional toll of dog bites. Victims may suffer from trauma, fear of dogs, or permanent scarring. Children may need counseling to overcome their fear, and families may face legal battles if their pet was responsible for the bite. So behind every number is a story, a person whose life was changed by an incident that, in many cases, could have been prevented. Conclusion of Chapter 3. The statistics make one thing clear: dog bites are a serious public health issue in the United States. Millions of incidents every year, hundreds of thousands of emergency room visits, and billions of dollars in costs remind us that prevention is not optional, it is necessary. By looking at these numbers, we also see where improvements are possible. Education programs for children, stricter leash laws in urban areas, better training for owners, and community awareness campaigns can all reduce the risk. In the next chapter, we will focus on the psychology of dogs, understanding their body language, emotions, and signals. This knowledge will help us interpret their behavior before a bite happens, giving humans the chance to step back and prevent an incident. One of the most powerful tools we have to prevent dog bites is understanding how dogs think and communicate. Unlike humans, dogs cannot use words, so they rely on body language, vocal sounds, and behavior to tell us how they feel. Sadly, many dog bites in the United States occur simply because people fail to recognize or misinterpret a dog's signals. In this chapter, we will take a deep dive into dog psychology, their emotions, and their body language. By the end, you will have a clearer understanding of what dogs are really saying, and how you can respond appropriately to prevent a bite. 1. How dogs think. The basics of canine psychology. Dogs are intelligent animals, but they do not think in the same way humans do. Instead of reasoning with logic and words, dogs rely heavily on instincts, experiences, and immediate emotions. Pack mentality. Dogs are pack animals. Even in American households, where dogs live as pets, they still see their family as their pack. This instinct influences their behavior, whether they act protective, submissive, or dominant. Fight or flight response. When threatened, dogs usually choose between fight or flight. If they cannot escape, they may resort to biting. Learning through association. Dogs connect actions with outcomes. For example, if a dog is punished harshly for growling, it may skip the growling next time and go straight to biting. This is why modern trainers recommend positive reinforcement instead of punishment. Understanding these instincts helps explain why dogs behave the way they do. 2. The emotional world of dogs. Dogs feel emotions such as happiness, fear, stress, jealousy, and even frustration. Most bites occur when negative emotions overwhelm the dog. Fear, the #1 trigger for bites. Frustration, a leashed dog that cannot reach something may lash out. Protectiveness, dogs often feel the need to guard their family, food, or territory. Overstimulation, loud noises, large crowds, or too much rough play can overwhelm dogs. Recognizing these emotional states early can prevent escalation. 3. Reading dog body language, the warning signs. Most dogs do not bite without warning. They give signals, sometimes subtle, sometimes obvious, that they are uncomfortable. Here are the key signals every American family should learn. Relaxed dog, safe to approach. Ears are neutral and relaxed. Tail wagging gently, body loose. Mouth slightly open, tongue out. Eyes soft, blinking normally. Stressed or uncomfortable dog, caution needed. Ears pinned back. Tail tucked between legs. Yawning or lip licking, not from tiredness, but stress. Turning head away or avoiding eye contact. Body stiff, weight shifted back. Warning signs of aggression, high risk of bite. Growling, snarling, or snapping. Showing teeth. Raised hackles, hair standing up on the back. Intense, unblinking stare. Rigid body, tail stiff or raised high. Unfortunately, many people ignore these signs, especially children who may see a growling dog as funny or playful. Recognizing these signals can literally save someone from being bitten. 4. The role of eye contact. In human culture, eye contact shows respect, honesty, or confidence. But in dog psychology, direct staring can be seen as a challenge or threat. If a stranger stares directly into a dog's eyes, the dog may feel threatened and respond aggressively. For this reason, dog experts in the United States often advise: avoid staring directly into a dog's eyes, especially if it is not your pet. Instead, glance to the side, keep your body relaxed, and allow the dog to approach you first. 5. The myth of the wagging tail. Many Americans grow up believing that a wagging tail always means a happy dog. This is only partly true. Tail wagging can signal excitement, but excitement is not always positive. Slow, wide wag, friendly and happy. High, stiff wag, alert or even aggressive. Fast, nervous wag, anxiety or stress. So, never assume a wagging tail means safe. Look at the entire body language, not just the tail. 6. How dogs communicate with vocal sounds. Dogs also use sounds to communicate their feelings. Barking can signal excitement, warning, or fear. Growling, usually a clear warning, back off. Punishing a growl is dangerous, because the dog may stop warning and skip straight to biting. Whining, a sign of stress, anxiety, or wanting attention. Snapping without contact, a serious warning that the dog is about to bite if the threat continues. Understanding these sounds helps us respond correctly. For example, if a dog growls, instead of yelling or punishing, it's safer to calmly give the dog space. 7. Cultural differences in dog behavior across the U.S. Interestingly, the way dogs behave can vary depending on environment and lifestyle. Urban dogs. In cities like New York or Los Angeles, dogs are often exposed to crowds, noises, and strangers daily. These dogs may become desensitized to chaos, but they may also develop stress-related behaviors. Suburban and rural dogs. In quieter areas, dogs may be less socialized with strangers. A dog living in a large property in Texas may see visitors as intruders, making territorial bites more likely. This shows why understanding context is important. A relaxed family dog in one home may behave very differently in another setting. 8. Teaching children to read dog signals. Children are the most common victims of dog bites in the US, which is why teaching them dog body language is crucial. Simple rules for kids include: never approach a dog that is eating, sleeping, or caring for puppies. Ask the owner for permission before petting a dog. Let the dog sniff your hand before touching. If a dog looks scared or growls, calmly step back. Programs in American schools and communities have shown that even short lessons about dog signals reduce by incidents significantly. 9. Strengthening the human-dog bond. When owners learn to read their dogs, it creates a stronger bond. Dogs feel safer when their signals are respected, and humans feel more confident when they can predict their pet's behavior. This mutual understanding is the foundation of a safe and loving relationship. Conclusion of Chapter 4. Dog psychology and body language are the keys to preventing bites before they happen. Most dogs give plenty of warnings when they are uncomfortable, but humans often miss the signs. By learning to recognize stress signals, respecting their emotions, and teaching children safe interaction, we can drastically reduce bite incidents in the United States. In the next chapter, we will explore the medical consequences of dog bites, what happens to the human body when a bite occurs, what infections are possible, and why immediate treatment is so important. Dog bites are not just about pain in the moment. They can have serious short-term and long-term medical consequences. In the United States, thousands of people visit emergency rooms each year because of dog bite injuries. While some wounds are small and heal quickly, others result in deep tissue damage, infections, and even life-threatening complications. In this chapter, we will take a detailed look at the medical side of dog bites, the types of injuries, the risk of infections, the potential for long-term damage, and the treatments that victims usually require. By understanding these consequences, we can better appreciate why prevention is so important. 1. The physical damage of dog bites. Dog bites vary in severity, but the injuries often reflect the power of a dog's jaw and teeth. Puncture wounds. Most bites create punctures from the dog's sharp teeth. These wounds may look small on the surface but can go deep, damaging muscles, nerves, or even bones. Tears and lacerations. When a dog shakes its head after biting, the teeth can tear skin and tissue. This is especially dangerous for children, who often suffer bites to the face or scalp. Crushing injuries. Large breeds like pit bulls, Rottweilers, and Mastiffs have incredibly strong jaws. Their bites can crush bones, especially in the hands, arms, or legs. Scarring and disfigurement. Many victims are left with permanent scars. For children, bites to the face can require multiple surgeries and may affect their confidence and emotional well-being for life. The severity of the injury depends not only on the size of the dog, but also on the location of the bite and how quickly medical care is received. 2. Risk of infections. One of the most dangerous consequences of dog bites is infection. A dog's mouth carries a wide variety of bacteria, and when teeth puncture the skin, these bacteria are introduced deep into tissues. Common infections include Pasteurella, found in more than 50% of dog bite wounds. It can cause painful swelling, redness, and pus. Staphylococcus, staph, and streptococcus. These bacteria can lead to skin infections and abscesses. Capnocytophaga, rare but dangerous, especially for people with weak immune systems. In some cases, it can lead to sepsis, a life-threatening blood infection. Rabies, rare in the United States thanks to vaccination programs, but still possible if the biting dog is not vaccinated. Rabies is almost always fatal once symptoms appear. Tetanus. Dog bites can introduce tetanus bacteria if the wound is deep, especially in people who are not up to date with vaccinations. Doctors in U.S. hospitals often prescribe antibiotics immediately after a bite, even before test results, because infection risk is so high. 3. Nerve and muscle damage. A dog's teeth can tear not only skin but also nerves and muscles. This can lead to loss of sensation in the affected area, weakness or difficulty moving fingers or limbs, chronic pain that lasts for months or years. Hand bites are especially dangerous, as the hand contains many delicate nerves and tendons. Even a small bite in the wrong place can leave permanent damage. 4. Injuries in children versus adults. Dog bite injuries affect children and adults differently. Children, often bitten on the face, neck, and head. These areas are highly visible, which makes scarring more serious. Plastic surgery may be required, and the trauma can affect self-esteem. Adults, more often bitten on the arms and hands, usually while trying to protect themselves or break up a dog fight. These bites may affect grip strength and long-term hand function. Because of their smaller size, children also lose more blood from severe bites and are more vulnerable to shock. 5. Psychological consequences. The medical consequences of dog bites are not only physical. Many victims, especially children, suffer long-term emotional effects. Fear of dogs, cynophobia. A child bitten once may develop an extreme fear of all dogs, even friendly ones. Post-traumatic stress disorder, PTSD victims may relive the attack in their minds, leading to nightmares, anxiety, or panic attacks. Social and emotional impact. Visible scars on the face or body can cause embarrassment or bullying, especially for children and teenagers. Psychological treatment may include therapy, counseling, or gradual re-exposure to friendly dogs in safe environments. 6. Emergency medical treatment for dog bites in the U.S. When someone is bitten by a dog, immediate steps are crucial. Stop the bleeding by applying gentle pressure with a clean cloth. Clean the wound with soap and water for at least 5 minutes. Cover the wound with a sterile bandage. Seek medical attention immediately, especially if the wound is deep, bleeding heavily, or near the face or joints. Report the bite to local authorities and confirm the dog's vaccination records. Doctors in U.S. hospitals may prescribe antibiotics, give tetanus or rabies shots if needed, perform stitches or surgery for deep wounds, recommend physical therapy for long-term recovery. 7. Long-term medical costs. The cost of medical treatment for dog bites in the United States is significant. Emergency room visits, hospital stays, surgeries, and rehabilitation can quickly add up. On average, a dog bite hospitalization in the U.S. costs around $18,000. This is nearly twice as expensive as the average hospital stay for other injuries. Insurance companies report that dog bite claims cost over $1 billion annually, showing the serious financial impact on victims and communities. 8. Case studies and real-life impact. Consider this: a young boy in California bitten on the face required over 20 surgeries to repair the damage. In another case, a postal worker in Texas was hospitalized for weeks after being attacked by 2 dogs. These stories highlight how quickly a bite can change someone's life. Behind every statistic is a person, someone who faced not just physical pain, but also emotional trauma, financial hardship, and long recovery. Conclusion of Chapter 5. Dog bites are not minor incidents. They can lead to deep wounds, infections, nerve damage, permanent scars, and even psychological trauma. In the United States, the medical consequences of dog bites are a major reason why prevention is so important. By understanding the risks and knowing how to respond, we can reduce both the physical and emotional harm caused by bites. In the next chapter, we will shift our focus to first aid and immediate actions. What to do the moment a dog bite happens, before professional medical help arrives. When a dog bite happens, the first few minutes are the most important. Quick, correct first aid can prevent infection, reduce pain, and sometimes even save a life. In the United States, emergency rooms treat hundreds of thousands of dog bite injuries every year, and doctors often say that many cases would have been less severe if the victim or their family had known proper first aid. In this chapter, we will go step by step through what to do immediately after a dog bite, how to handle different types of wounds, when to seek medical attention, and why first aid is a critical part of bite prevention and recovery. 1. Stay calm and assess the situation. The first reaction after a bite is usually panic, but panic can make things worse. The victim, the dog, and everyone nearby need calm responses. Move to safety. If the dog is still aggressive, create distance immediately. Do not try to punish or fight back, as this may escalate the situation. Stay calm. Rapid movements or screaming can stress the dog further. Check the wound. Determine if the bite is minor, moderate, or severe. In American households, especially where children are involved, parents should act quickly but keep a steady voice to avoid frightening the child even more. 2. Control bleeding. Minor bleeding. If the wound is small, let it bleed slightly for a few seconds. This can help flush out bacteria. Heavy bleeding. Apply firm, steady pressure with a clean cloth or sterile bandage. Elevate the injured area above the heart if possible. Severe bleeding. If the bleeding does not stop after 10 minutes of pressure, call 911 immediately. 3. Clean the wound thoroughly. Cleaning is the most important step in preventing infection. Wash hands with soap before touching the wound. Rinse the wound under running lukewarm water for at least 5 minutes. Use mild soap to gently clean around the wound. Avoid harsh scrubbing, which can damage tissue. Do not use strong disinfectants like hydrogen peroxide directly inside deep wounds, as they may harm tissue. Instead, use antiseptic solutions recommended for first aid. In U.S. hospitals, doctors often report that infections occur because the wound was not cleaned properly at home. 4. Apply first aid dressings. After cleaning, gently pat the wound dry with a clean towel. Apply an antibiotic cream, such as Neosporin, to reduce infection risk. Cover the wound with a sterile bandage or gauze. Change the dressing at least once a day, or sooner if it becomes wet or dirty. 5. Seek medical attention. Not all bites need stitches, but many require professional care. You should always seek medical attention if the bite is deep, large, or near the face, neck, or joints. The wound is bleeding heavily and will not stop. The dog is unknown, stray, or unvaccinated. You have not had a tetanus shot in the last 5 years. Signs of infection appear: swelling, redness, pus, fever. Doctors in the U.S. often prescribe antibiotics for dog bites, especially hand injuries, because infections spread quickly in those areas. 6. Rabies and tetanus considerations. Rabies. In the United States, rabies cases are rare, but still taken very seriously. If the dog's vaccination history is unknown, doctors may begin rabies post-exposure treatment. This involves a series of shots that must be started quickly. Tetanus. If the wound is deep and the victim has not had a tetanus booster within the last 5 years, doctors will usually recommend one. 7. First aid for different types of bites. Not all dog bites look the same, so first aid may vary. Superficial scratches or small bites. Clean thoroughly, apply antibiotic ointment, cover with a bandage. Deep puncture wounds. Clean as much as possible, apply sterile dressing, and seek medical care quickly. Crushing injuries. Apply pressure to control bleeding, immobilize the limb, and call for emergency medical help. Facial bites. Do not attempt home treatment beyond basic cleaning. Seek professional help immediately to minimize scarring. 8. What not to do after a dog bite. Many myths about dog bite first aid exist, and some can make things worse. Avoid these common mistakes. Do not try to burn or cauterize the wound. Do not close deep wounds with adhesive bandages. This can trap bacteria. Do not wait to see if it heals on its own. Infections can develop within hours. Do not blame or beat the dog immediately. This can create fear and more aggression. 9. Reporting the bite. In the United States, dog bites should be reported to local animal control or public health departments, especially if the dog is unknown or not vaccinated. Authorities may quarantine the dog to check for rabies symptoms. Investigate the incident to prevent future attacks. Provide guidance on vaccination requirements. This reporting helps protect both the community and the victim. 10. Emotional first aid. Dog bites are not just physical injuries, they are emotional events too. For children, a bite can be terrifying. Parents should reassure the child that they are safe. Explain calmly that the dog was scared or protective. Avoid shaming the child for causing the bite. Adults may also experience shock, fear, or anger. Talking to a doctor, counselor, or support group can help manage the emotional impact. Conclusion of Chapter 6. The moments after a dog bite are critical. By staying calm, controlling bleeding, cleaning the wound, applying dressings, and seeking medical help when necessary, victims can dramatically reduce the risk of serious complications. In the United States, where millions of dog bites occur each year, first aid knowledge is just as important as CPR or fire safety. It can save lives, reduce suffering, and speed recovery. In the next chapter, we will explore prevention strategies for families and communities, how to reduce the risk of dog bites before they even happen. Dog bites are painful, dangerous, and often preventable. In the United States, experts estimate that more than 70% of dog bite incidents could be avoided with better education, awareness, and responsible behavior from both dog owners and the general public. Prevention is the best medicine. It saves lives, reduces healthcare costs, and protects the bond between humans and dogs. In this chapter, we will explore practical strategies for preventing dog bites at the family level, community level, and individual level. 1. Responsible dog ownership. Prevention starts at home, with the dog owner. A well-trained, well-socialized dog is much less likely to bite. Training. Enroll dogs in obedience classes, especially during puppyhood. Commands like sit, stay, leave it, and come can prevent accidents. Socialization. Expose puppies to different people, children, and situations in a controlled way. Dogs that are comfortable with variety are less fearful and less likely to react with aggression. Spaying or neutering. Research in the United States shows that spayed or neutered dogs are generally calmer and less prone to aggressive behavior. Safe environment. Provide a secure yard or fenced area so the dog cannot escape and encounter strangers unsupervised. 2. Teaching children about dogs. Children are the most common victims of dog bites. Education is critical. In American households, parents should teach children simple safety rules. Never disturb a dog that is eating, sleeping, or caring for puppies. Always ask permission before petting someone else's dog. Avoid hugging dogs too tightly. Dogs may interpret this as restraint and feel threatened. If a dog runs toward you, stand still like a tree, with arms at your side and eyes looking away. Running or screaming can trigger chasing instincts. Never pull on a dog's ears, tail, or fur. Schools and community programs across the United States often run bite prevention workshops for kids, and studies show they significantly reduce bite incidents. 3. Reading dog body language. Dogs usually give warning signs before biting. Learning to recognize these signs can prevent accidents. Signs of stress or fear: ears back, tail tucked, licking lips, yawning, avoiding eye contact. Signs of aggression: growling, baring teeth, raised hackles, stiff posture, intense staring. Signs to respect: if a dog freezes suddenly, it often means back off. In the US, animal behaviorists often stress that most bites don't come out of nowhere. They come after ignored warning signals. 4. Approaching dogs safely. Even well-meaning adults can make mistakes when approaching unfamiliar dogs. Follow these guidelines. Ask the owner first. Always. Let the dog sniff your hand before petting. Pet under the chin or on the chest, not over the head. Dogs may find a hand reaching down intimidating. Approach calmly and slowly. Quick movements may scare the dog. 5. Community-level prevention. Dog bite prevention is not just a family responsibility, it's a community responsibility too. In the United States, many cities and counties enforce laws that help reduce incidents. Leash laws. Dogs in public spaces must be leashed. Licensing and vaccination. Registered, vaccinated dogs are safer for everyone. Education programs. Schools, parks, and community centers run dog safety classes. Animal control services. Stray or aggressive dogs are quickly managed by professionals. Community campaigns such as Be a Responsible Dog Owner encourage safe practices across neighborhoods. 6. Preventing bites inside the home. Most dog bites actually happen in the home, with a family's own dog. This surprises many people, but it makes prevention inside the house just as important as prevention outside. Supervise children and dogs at all times. Even trusted family dogs can react unexpectedly if startled. Teach boundaries. Create safe zones for the dog, such as a crate or bed, where it cannot be disturbed. Monitor play. Rough play, tug-of-war, or wrestling can escalate into accidental bites. Avoid punishment-based training. Hitting or shouting can make a dog fearful, increasing bite risks. 7. Preventing bites from stray or unknown dogs. Stray dogs exist in many U.S. communities, especially in rural areas. To stay safe, do not approach stray dogs, even if they seem friendly. Report strays to local animal control. If attacked, protect your face and neck, and try to place an object, like a bag or jacket, between you and the dog. 8. Special considerations for service and working dogs. Service dogs, police dogs, and guard dogs are specially trained but should also be respected. In the U.S., interfering with service dogs is even against the law. Do not pet service dogs on duty. Follow commands given by police or military dog handlers. Educate children that some dogs are working, not pets. 9. The role of public health campaigns. Public health departments in the United States often run campaigns about rabies vaccination, responsible ownership, and bite prevention. These campaigns work best when communities participate actively. Some states even include dog bite prevention in school safety programs. 10. Summary. Prevention is protection. Preventing dog bites requires cooperation between individuals, families, and communities. By being responsible owners, teaching children safe behavior, respecting dog signals, and following community rules, we can dramatically reduce the number of bite incidents in the United States. Dog bite prevention is not about creating fear of dogs, it's about building respect, understanding, and safe relationships. When prevention is taken seriously, both people and dogs benefit. Closing note for Chapter 7. By practicing prevention, we protect our families, reduce medical emergencies, and ensure dogs live happier, healthier lives. In the next chapter, we will discuss the medical treatment process after a dog bite, what doctors do, what victims should expect, and how recovery usually progresses. When a dog bite happens, the experience can be frightening, painful, and confusing. Many people in the United States are unsure about what steps to take after being bitten. Should they clean the wound at home? Should they rush to the hospital? Should they worry about rabies? The truth is, every dog bite should be taken seriously. Even what looks like a small bite can lead to serious infections, nerve damage, or long-term scarring. In this chapter, we will carefully walk through the medical treatment process, starting from the very first steps after the bite, all the way to long-term recovery and follow-up care. 1. Immediate first aid at the scene. The first few minutes after a dog bite are critical. Here's what medical professionals in the United States recommend. Stay calm and safe. Move away from the dog to prevent further injury. Control bleeding. Use a clean cloth or bandage to apply gentle pressure if the wound is bleeding heavily. Clean the wound thoroughly. Wash the bite with soap and warm running water for at least 5 to 10 minutes. This step alone can significantly reduce the risk of infection. Apply antiseptic. Use over-the-counter antiseptics like iodine or hydrogen peroxide if available. Cover with a clean bandage. Keep the wound protected until medical help is available. Even if the wound seems minor, you should seek professional medical evaluation as soon as possible. 2. When to seek emergency medical care. Not every bite requires the same level of care, but there are clear situations where you must go to the emergency room immediately. Deep puncture wounds or torn skin. Heavy bleeding that does not stop. Bites to the face, neck, or hands. Signs of nerve injury, such as numbness or inability to move fingers. If the dog's vaccination history is unknown. If the victim is a child, elderly person, or someone with a weakened immune system. In the U.S., emergency departments are well equipped to handle dog bites, and seeking help early can prevent serious complications. 3. The role of healthcare providers. Once at a hospital or clinic, doctors follow a structured protocol. Detailed medical history. Doctors will ask about the dog, stray or pet, vaccinated or not, the circumstances of the bite, and the victim's health background. Wound cleaning and examination. Medical staff will often irrigate the wound again with sterile solution to reduce bacteria. Stitches or surgical repair. Not all bites are stitched. Sometimes, leaving a wound open helps prevent infection. Deep or cosmetic wounds, especially on the face, may require sutures. Antibiotics. Because dog mouths carry bacteria, many patients are prescribed antibiotics to prevent infection. Pain management. Over-the-counter painkillers may be suggested, or stronger medication if the wound is severe. 4. Rabies prevention. Rabies is a deadly but preventable viral disease. In the United States, rabies in domestic dogs is rare thanks to widespread vaccination programs, but it is still a concern, especially with stray dogs or dogs of unknown vaccination history. If the dog is a family pet with up-to-date rabies shots, the risk is extremely low. If the dog is unknown or stray, post-exposure rabies vaccination may be recommended. Rabies treatment usually involves a series of shots given over several weeks. Doctors will follow CDC, Centers for Disease Control and Prevention, guidelines to decide if rabies shots are necessary. 5. Tetanus shots. Another important consideration is tetanus. Dog bites can introduce tetanus bacteria into the body. If the patient's last tetanus booster was more than 10 years ago, a new shot will be given. For severe or dirty wounds, the booster may be given if it has been more than 5 years since the last dose. 6. Infection risks and monitoring. Infections are the most common complication of dog bites. Symptoms include redness and swelling around the wound, warmth or pus discharge, fever or chills, increased pain. Doctors may schedule follow-up visits to check for signs of infection. In severe cases, for antibiotics or even surgery may be needed. 7. Recovery timeline. The recovery process depends on the severity of the bite. Minor bites, with proper cleaning and antibiotics, healing may take 7 to 10 days. Moderate bites with stitches, healing may take 2 to 3 weeks, with regular wound care and dressing changes. Severe bites with surgery, recovery could take months, especially if skin grafts or reconstructive procedures are needed. 8. Psychological impact. Dog bites are not only physical injuries, they can also cause emotional trauma. Victims, especially children, may develop fear of dogs, nightmares, or even post-traumatic stress disorder, PTSD. Counseling or therapy may be helpful in overcoming these fears. In the US, some hospitals offer trauma counseling alongside medical care for bite victims. 9. Scar management and cosmetic treatment. Scarring is another concern, particularly for bites to the face or hands. Recovery may involve special scar creams and silicone sheets, laser therapy, plastic or reconstructive surgery in severe cases. The goal is to restore both function and appearance, helping victims regain confidence. 10. Legal and reporting steps. In the United States, medical professionals are often required to report dog bites to local animal control or public health authorities. This ensures that dangerous dogs are tracked, and rabies monitoring is conducted properly. Victims may also consult with a lawyer if negligence by the dog owner contributed to the bite. Medical bills, lost wages, and pain and suffering can sometimes be recovered through legal action. 11. Long-term care and prevention. After medical treatment, patients are advised to keep the wound clean and dry until healed. Attend all follow-up appointments. Watch for delayed infection symptoms. Educate themselves about dog safety to prevent future incidents. 12. Summary: healing beyond the bite. Recovering from a dog bite involves more than just healing a wound. It is about stopping infection and disease, restoring physical function, supporting emotional well-being, ensuring the bite is reported for community safety. With timely and proper care, most dog bite victims in the U.S. make a full recovery and return to normal life. Closing note for Chapter 8. In this chapter, we learned how to treat and recover from a dog bite, from first aid to medical care, and from physical healing to emotional recovery. In the next chapter, we will explore the legal responsibilities of dog owners in the United States and what victims can do if they suffer from a bite. Dog bites are not only a medical issue, they are also a serious legal matter. Every year, thousands of people across the United States file claims and lawsuits related to dog bite injuries. The law is designed to protect both public safety and the rights of bite victims. In this chapter, we will explore the legal responsibilities of dog owners, the rights of victims, and the steps both parties must take after a dog bite incident. 1. Dog owners' legal responsibilities. Owning a dog in the United States comes with legal duties. These responsibilities exist to prevent attacks and ensure public safety. Proper control and supervision. Dog owners are required to keep their pets under control at all times, whether through leashes, fences, or secure enclosures. Vaccination requirements. Rabies vaccination is mandatory in all U.S. states. Owners must keep vaccination records updated. Preventing known dangers. If a dog has shown aggression before, the owner has a higher duty of care. Failing to warn others or restrain the dog can be considered negligence. Local leash laws and ordinances. Many states and cities have leash laws. If an owner violates them and the dog bites someone, they may be held legally liable. In other words, the law expects dog owners to act responsibly to prevent harm. 2. Strict liability versus One bite rule. Dog bite laws in the US vary by state. The two main legal approaches are strict liability and the one bite rule. Strict liability states. In these states, the dog owner is automatically responsible for any bite, even if the dog had never bitten before. The victim does not need to prove negligence. Examples include California, Florida, and Illinois. One bite rule states. In these states, the first bite might not create liability if the owner had no reason to believe the dog was dangerous. However, after the first bite or show of aggression, the owner can be held fully responsible for future attacks. States like Texas and Virginia often follow this rule. Knowing which law applies in your state is crucial for both owners and victims. 3. Victim rights after a dog bite. If you are bitten by a dog in the United States, you have important rights. The right to medical treatment costs. Victims can recover expenses for hospital visits, medications, surgeries, and future medical care. The right to lost wages. If the bite causes time away from work, victims can claim compensation for lost income. The right to pain and suffering damages. Physical pain, emotional trauma, and reduced quality of life are also compensable. The right to legal representation. Victims may hire an attorney to protect their rights and file claims against the dog owner. 4. Reporting the bite. In most U.S. states, dog bites must be reported to local animal control or public health authorities. This is important because it ensures the dog is checked for rabies or other diseases. It creates an official record of the incident. It may lead to quarantine of the dog for observation. Failure to report a bite could put others at risk and weaken a victim's legal case later. 5. Insurance and compensation. Dog bites are one of the most common causes of homeowners' insurance claims in the United States. Homeowners or renters insurance usually covers dog bite liability, up to a certain dollar amount. If damages exceed insurance limits, victims may file a lawsuit directly against the owner. Some insurance companies exclude coverage for certain breeds, such as pit bulls or Rottweilers, making owners personally responsible. This means that victims often don't have to bear medical costs themselves. The dog owner's insurance typically covers it. 6. Dangerous dog designation. In many states, if a dog attacks more than once or causes serious injury, it may be declared a dangerous dog or vicious dog. Consequences can include mandatory muzzling in public, court-ordered obedience training, higher insurance requirements. In severe cases, euthanasia of the dog. These laws are designed to protect the public from repeated attacks. 7. Defenses dog owners may use. Sometimes dog owners defend themselves against bite claims by arguing. Trespassing. If the victim was unlawfully on private property, the owner may not be liable. Provocation. If the victim teased, hit, or provoked the dog, liability may be reduced. Assumption of risk. In some cases, professionals like veterinarians or dog groomers assume certain risks by working with animals. Courts carefully review each case to determine fairness. 8. Child victims and special protections. Children are the most common victims of dog bites. U.S. law often gives extra protection to minors. Settlements involving children usually require court approval. Parents may seek damages for both medical bills and the child's long-term emotional trauma. If scarring is permanent, future cosmetic surgery costs may also be included in compensation. 9. Criminal liability for dog owners. In extreme cases, dog owners may face criminal charges. Reckless endangerment if the owner knowingly let a dangerous dog roam free. Failure to follow court orders regarding a previously declared dangerous dog. Animal cruelty charges if neglect contributed to the attack. These charges can result in fines, probation, or even jail time. 10. Steps for victims to take after a bite. If you are bitten, here are the steps recommended by U.S. legal experts. Seek medical attention immediately. Report the bite to local authorities. Gather evidence, take photos of injuries, save medical bills, and get witness statements. Identify the dog and its owner. Consult with a personal injury attorney if the injuries are serious. File insurance claims if applicable. Taking these steps strengthens a victim's case for fair compensation. 11. Public policy and prevention. Dog bite laws also reflect a bigger goal, preventing future attacks. By holding owners accountable, the law encourages responsible pet ownership. It also educates the public on safety and promotes vaccination programs to keep communities safe. 12. Summary: justice for victims, responsibility for owners. Dog bite incidents in the United States are treated with seriousness under the law. The system is designed to protect the public, compensate victims fairly, hold negligent owners accountable, prevent future attacks through regulation. Understanding your rights and responsibilities is the key to handling dog bite cases fairly and effectively. Closing note for Chapter 9. In this chapter, we explore the legal framework of dog bite cases in the U.S., from strict liability laws to victim compensation rights. In the next chapter, we will focus on preventive measures and how communities can work together to reduce dog bite incidents. Dog bites are a serious public health concern in the United States, but the good news is that many bites are preventable. While individual actions, such as responsible dog ownership and proper first aid, are crucial, community-wide strategies play an equally important role. By educating the public, creating safer environments, and promoting responsible behavior, communities can significantly reduce the number of dog bite incidents. In this final chapter, we will explore preventive measures at the community level, public awareness campaigns, and practical strategies for both adults and children to live safely alongside dogs. 1. The importance of public awareness. Education is the foundation of prevention. In the U.S., public awareness campaigns help people understand dog behavior and how to prevent bites. School programs. Many elementary schools include dog safety lessons, teaching children how to approach dogs safely and recognize warning signs. Community workshops. Libraries, community centers, and local animal shelters often run seminars on bite prevention. Social media campaigns. Public health departments use social media platforms to reach wide audiences with tips, videos, and infographics about dog safety. Raising awareness not only reduces injuries, but also encourages responsible dog ownership in neighborhoods. 2. Safe public spaces. Communities can reduce dog bite incidents by creating safer public spaces for both humans and dogs. Leash laws. Enforcing leash laws in parks and neighborhoods ensures that dogs remain under control in public areas. Dog parks. Designated areas for dogs to play off-leash provide socialization opportunities while keeping other residents safe. Clear signage. Signs warning of dog rules, leash requirements, and restricted areas prevent accidents. Waste management. Providing bags and bins for dog waste encourages responsible pet behavior and hygiene, indirectly reducing aggressive behaviors related to stress or competition over territory. 3. Community training and support programs. Community programs focused on training and responsible ownership are highly effective. Obedience training courses. Offered by local shelters or dog clubs, these courses help owners teach dogs commands that prevent aggressive behavior. Behavioral evaluation programs. Dogs showing early signs of aggression can be assessed and guided before incidents occur. Support for first-time owners. Workshops on puppy care, socialization, and safe interactions reduce bite risks. 4. Reporting and monitoring dogs. A proactive approach to monitoring dogs in the community can prevent future bites. Animal control reporting. Residents should report stray or aggressive dogs to authorities. Vaccination tracking. Ensuring all dogs are vaccinated against rabies helps maintain public health. Quarantine and observation. Dogs involved in bite incidents are often quarantined for observation to confirm they are not carrying rabies. Monitoring and reporting are essential responsibilities of both citizens and local authorities. 5. Educating children about dog safety. Children are particularly vulnerable to dog bites, so targeted education is key. Recognize body language. Teaching kids to identify warning signs, like growling, stiff posture, or avoiding eye contact, reduces bites. Safe interactions. Children should learn to approach dogs calmly, ask permission, and avoid hugging or startling animals. Emergency response. Teaching kids what to do if a dog attacks, such as standing still or curling into a ball, can prevent serious injuries. Schools and pediatricians in the U.S. often incorporate these lessons into health and safety education. 6. Responsible pet ownership across the community. When owners in a community take responsibility for their dogs, everyone benefits. Microchipping helps locate lost dogs quickly, preventing confrontations with strangers. Regular vet visits. Ensuring dogs are healthy and vaccinated reduces disease risk and aggressive behavior caused by pain or discomfort. Supervision. Dogs should never be left unsupervised in public or around children. Spaying and neutering helps reduce aggression and territorial behavior. Responsible ownership sets a standard and influences neighbors to act similarly. 7. Collaborative community strategies. Communities can work together in many ways to prevent dog bites. Neighborhood watch programs. Residents can look out for stray or aggressive dogs. Pet registration drives. Ensures accurate records of ownership, vaccination, and licensing. Volunteer programs at shelters. Educating prospective adopters on safe practices prevents future bite incidents. Public recognition. Celebrating responsible owners encourages good behavior and accountability. 8. Media and technology in prevention. Modern technology helps communities spread awareness quickly. Mobile apps. Many US cities have apps to report stray or aggressive dogs directly to animal control. Social media, sharing safety tips and bite prevention information helps families learn proper interactions with dogs. Online training resources, video tutorials and webinars teach safe dog handling and first aid techniques. Technology increases accessibility to important safety information for all age groups. 9. Benefits of a bite-free community. When a community takes preventive measures seriously, the benefits are clear. Fewer medical emergencies and lower healthcare costs. Reduced emotional trauma from bites, especially for children. Stronger human-dog relationships based on trust rather than fear. Increased public confidence in parks, schools, and neighborhoods. Prevention is more than rules. It creates safer, happier communities for both humans and dogs. 10. Summary. Prevention is everyone's responsibility. Preventing dog bites requires action at every level. Individuals, learn dog behavior, practice safe interactions, and seek training. Families, educate children, supervise pets, and maintain vaccinations. Communities, enforce leash laws, report aggressive dogs, and provide educational programs. Authorities, monitor bites, ensure vaccination compliance, and promote public awareness. By working together, we can reduce dog bite incidents and create environments where people and dogs coexist safely. Closing note for Chapter 10. This concludes our 10-chapter guide on dog bites. From understanding dog behavior, medical consequences, first aid, treatment, legal responsibilities, and prevention, to community awareness, each step plays a vital role in safety. Remember, prevention, awareness, and responsible action are the keys to reducing dog bite injuries in the United States. With the knowledge from this guide, families, communities, and dog owners can make informed choices that protect both humans and dogs. While the previous chapters have covered first aid, legal responsibilities, and community awareness, long-term safety requires advanced strategies. These strategies focus not just on reacting to dog bites but on preventing them altogether and building a safe, lasting relationship with dogs. In the United States, advanced prevention helps families, schools, and communities reduce incidents even further. 1. Understanding dog behavior deeply. A deeper understanding of dog behavior helps prevent bites before they happen. Stress signals. Dogs show subtle signs of stress, including lip licking, yawning, turning their head away, and pacing. Recognizing these signals can prevent escalation. Territorial behavior. Dogs may feel protective over certain areas, like their home, yard, or even favorite toys. Avoid entering these spaces without caution. Fear-based aggression. Dogs often bite out of fear rather than anger. Identifying fear triggers, like sudden movements, loud noises, or unfamiliar people, helps prevent incidents. Advanced dog owners and caregivers often use behavior observation logs to track stress triggers and responses in their dogs. 2. Safe handling and interaction techniques. Advanced prevention includes safe handling practices. Leash and harness training. Teach your dog to walk calmly on a leash and respond to commands in all environments. Controlled introductions. Introduce your dog to new people and other pets slowly and under supervision. Avoiding high-risk situations. Be cautious around unfamiliar dogs, large groups of children, or intense play situations that may overwhelm your dog. Use of barriers. Gates, crates, or baby fences can create safe zones in the home for both dogs and children. 3. Advanced training for aggressive or reactive dogs. For dogs with aggression history, advanced training is critical. Professional dog trainers or behaviorists can work with reactive dogs to desensitize triggers. Positive reinforcement techniques help dogs learn appropriate behavior without fear or pain. Gradual socialization allows dogs to become comfortable with new people and environments safely. Behavior modification programs often prevent repeat bites and improve overall dog owner safety. 4. Family education and consistency. Long-term safety requires consistent rules and education within families. Teach all household members the same commands and safety protocols. Supervise interactions between dogs and children, even if the dog is calm and friendly. Reinforce safe behavior with rewards for both children and dogs when they interact safely. Avoid unsafe routines, such as unsupervised play or roughhousing. Consistency helps dogs understand expectations and reduces bite risks. 5. Environmental management. Creating a safe physical environment can prevent bites. Secure fencing. Ensure fences are tall and sturdy enough to prevent escapes. Gates and barriers. Keep dogs away from doorways when guests arrive. Safe play areas. Designate areas for children and dogs separately when needed. Minimize triggers. Avoid leaving high-value items, food, toys, where they may provoke possessive behavior. 6. Community-level long-term measures. Communities can also implement long-term preventive strategies. Ongoing dog bite education programs in schools and local centers. Neighborhood watch for aggressive or stray dogs. Encouraging responsible pet ownership through registration, vaccination, and local events. Pet therapy programs that teach children safe interaction with well-trained dogs. When communities take responsibility together, incidents decline significantly. 7. Monitoring and medical preparedness. Even with prevention, accidents can happen. Long-term safety includes keeping first aid kits accessible at home and in cars, knowing local medical resources that handle dog bites quickly, tracking vaccinations for all dogs in the household, maintaining emergency contacts, including local animal control. Preparedness ensures that if an incident occurs, its impact is minimized. 8. Mental and emotional safety. Dog bites can have lasting emotional effects. Long-term prevention also means managing mental well-being. Desensitization programs for children who develop fear of dogs. Gradual exposure to calm, well-behaved dogs to rebuild confidence. Counseling or therapy for severe trauma cases. Promoting respect, not fear, for animals in all educational programs. Building emotional resilience helps both children and adults safely interact with dogs throughout life. 9. Technology and long-term safety. Modern technology can assist long-term prevention. Monitoring devices for dogs, including activity trackers and GPS collars. Smart home cameras to supervise dog interactions with family members. Educational apps for bite prevention training and awareness. Online behavior consultation with certified trainers and veterinary professionals. Technology allows for proactive supervision and preventive interventions before incidents escalate. 10. Summary: building a safe future with dogs. Advanced prevention is about creating a lifestyle where dog bites are unlikely. Understanding dog behavior deeply. Training and socialization for all dogs, especially reactive ones. Family education and consistency. Safe home and community environments. Preparedness for emergencies. Emotional resilience for humans. When families and communities adopt these strategies, dog bites can be dramatically reduced, and relationships between humans and dogs can flourish safely. Closing note for Chapter 11. Long-term dog bite prevention is a shared responsibility. It requires knowledge, preparation, and consistent practice. By applying advanced safety tips, families and communities in the United States can ensure dogs remain loving companions while minimizing risks. This chapter concludes the Advanced Safety Strategies segment of our guide. Combined with the previous chapters on first aid, treatment, legal responsibilities, and prevention, it completes a comprehensive roadmap for dog bite safety. Up to this point, we have covered dog bite causes, prevention, first aid, medical treatment, legal responsibilities, community awareness, and advanced safety strategies. Chapter 12 focuses on bringing all this knowledge together into a cohesive approach that individuals, families, and communities in the United States can apply for long-term dog bite safety. Dog bite prevention is most effective when education, awareness, and proactive measures work in harmony. This chapter is about integrating everything you have learned and creating a culture of safety. 1. Combining individual responsibility with community efforts. Prevention starts at home but extends to neighborhoods and schools. Individual responsibility, safe handling, training, vaccination, and proper supervision of dogs. Family responsibility, educating children, following safety protocols, and maintaining emotional awareness. Community responsibility, enforcing leash laws, public education, dog registration, and reporting aggressive or stray dogs. Each layer reinforces the others, creating a network of safety that reduces dog bite risks. 2. Building a family safety plan. Families can create a structured approach to prevent dog bites. Designated safe zones in the home for dogs and children. Clear rules for interactions that all household members follow consistently. First aid preparedness, kits, emergency contacts, and basic wound care knowledge. Regular dog behavior assessments, tracking stress triggers, reactions, and progress in training. A family safety plan ensures everyone knows how to behave around dogs and respond appropriately to incidents. 3. Integrating education in schools and workplaces. Public awareness is most effective when integrated into formal education and community programs. School curriculum, teaching children dog body language, bite prevention strategies, and emergency response. Workplace programs, educating staff in childcare, healthcare, and veterinary settings about dog safety. Community workshops, involving families in interactive learning about bite prevention and responsible ownership. Education reinforces safe habits, which become lifelong practices. 4. Coordinating with local authorities. Safety requires coordination with city and state authorities. Animal control, quick response to stray or aggressive dogs. Public health departments, rabies vaccination programs, bite tracking, and public safety campaigns. Law enforcement, enforcement of dangerous dog laws, leash regulations, and legal compliance. Community leaders, encouraging neighborhood-level programs and awareness campaigns. Working together ensures that policies, prevention, and education are consistent across the community. 5. Incorporating medical knowledge into daily practices. Understanding medical treatment and recovery helps prevent complications. Immediate first aid, every household should know how to wash wounds and control bleeding. Recognizing infection signs, redness, swelling, warmth, or pus should prompt professional care. Regular veterinary checkups, healthy dogs are less likely to bite due to pain or stress. Vaccination and boosters, ensuring both humans and dogs are protected against rabies and tetanus. Medical awareness complements behavioral and legal strategies to reduce risk. 6. Legal awareness as a safety tool. Knowledge of legal responsibilities helps prevent bite incidents. Dog owners must understand liability laws in their state, including strict liability and one-bite rules. Reporting bite incidents protects both victims and the community. Insurance awareness ensures that medical costs or damages are covered. Understanding dangerous dog designations helps prevent repeat incidents. Legal awareness is not only reactive but also preventive. It encourages responsible ownership. 7. Long-term preventive measures. Sustained safety requires advanced, proactive strategies. Continuous dog training and socialization. Family reinforcement of rules and safe practices. Community education and monitoring programs. Mental and emotional preparation for potential incidents. Utilizing technology such as monitoring devices, apps, and online resources. Long-term prevention is a combination of knowledge, practice, and vigilance. 8. Fostering a culture of respect and understanding. Ultimately, dog bite prevention is about building a culture of respect. Respecting dogs' boundaries. Teaching children empathy toward animals. Encouraging responsible ownership in communities. Promoting safety as a shared value. When respect becomes a habit, incidents decrease, and relationships between humans and dogs improve. 9. Measuring success and continuous improvement. Communities and families should periodically review their dog bite prevention strategies. Track bite incidents and responses. Evaluate effectiveness of educational programs. Update household safety plans and training. Adjust community policies based on data and feedback. Continuous improvement ensures that safety measures evolve with changing environments and challenges. 10. Summary: integrating knowledge for lifelong safety. Dog bite prevention is a multi-layered approach that combines individual and family responsibility, community awareness and education, medical knowledge and preparedness, legal understanding and compliance, advanced strategies and technology, respectful and empathetic human-dog relationships. By integrating these elements, families and communities in the United States can dramatically reduce dog bite incidents and create safe environments where both humans and dogs thrive. Closing note for Chapter 12. Chapter 12 emphasizes that dog bite safety is not a single action. It is a lifestyle, a set of habits, and a shared responsibility. By bringing together all the lessons from previous chapters, you now have a comprehensive roadmap for prevention, treatment, legal awareness, and long-term safety. This concludes our full guide on dog bite safety, giving families, dog owners, and communities the tools to prevent incidents, respond effectively when they occur, and maintain a safe and harmonious relationship with dogs.